This is VOA Africa.
Hello, I'm Esther Githui-Ewart. It's Tuesday, December 1st. This is Africa 54. Due to the global outbreak of COVID-19, Voice of America is taking every necessary precaution to safeguard its employees. So our broadcast will look a little different today and in the near future as we, out of an abundance of caution, reduce our staffing at VOA headquarters here in Washington. We're working to help keep you informed about what's going on, and we appreciate you staying with us on Africa 54. Tuesday, December 1st is World AIDS Day. 4 years ago, governments around the world committed to UN goals that would end the AIDS pandemic. VOA's Carol Pearson tells us why these goals are so elusive and how a major city succeeded.
The world has had the tools to end AIDS for the past decade. Anti-AIDS drugs make it nearly impossible for those who are positive to pass the virus to someone else. There are also drugs that people with a high risk of acquiring HIV can take to prevent transmission. 4 years ago, governments around the world committed to achieving 3 targets: diagnosing 90% of those who have HIV, treating 90% of those diagnosed, and suppressing the virus to undetectable levels in 90% of those being treated. Yet experts say we aren't even close to ending the pandemic.
2020 was supposed to be the year in which we were going to see really significant declines in new infections, down under 500,000 worldwide. And we had more than 1.7 million new infections in 2019. So we are way off the targets of actually getting control of HIV transmission.
Byrer says teenagers and young adults are especially vulnerable.
We're still seeing that people acquire HIV when they're relatively young, particularly in sub-Saharan Africa, but also true in the United States and true in Latin America and the Caribbean, East Asia, Southeast Asia. And then they are not starting therapy until quite a bit later.
This is a huge problem for young men, Byrer says. They don't normally see doctors and are not likely to be tested until they develop symptoms. As a result, they die sooner than women with HIV, and they have had years to pass the virus to their partners, he adds. HIV thrives in countries where it's a crime to be a sex worker, or to be gay or transgender, where IV drug users are punished, or where these groups are stigmatized. More than 60% of new HIV infections are in these groups. New York City achieved the UN goals through a program that expanded health care to include those at risk of getting HIV.
Much of what we did in New York City with ending the epidemic came directly from communities. Like, for instance, the work that we did with transgender-led organizations, like we literally listened to what the transgender-led organizations needed, and we designed something to fit that need.
Daskalakis says that AIDS prevention succeeded in New York because health services focused on providing care and not on the identities of those being served. Daskalakis will soon oversee the HIV/AIDS program at the Centers for Disease Control and Prevention. He says he feels confident that the U.S. can achieve similar results by listening to what different groups need. Carol Pearson, VOA News, Washington.
As the world commemorates World AIDS Day, the United Nations Children's Fund says approximately every minute and 40 seconds, a child or young person under the age of 20 was newly infected with HIV last year. In its new report, Reimagining a Resilient HIV Response for Children, Adolescents, and Pregnant Women Living with HIV, UNICEF warns that children are being left behind in the fight against HIV, and prevention efforts and treatment for children remain some of the lowest amongst key affected populations. 320,000 children and adolescents were newly infected with HIV in 2019. For more on the subject, Africa 54 Linord Moudou spoke to Dr. Shaffiq Essajee, Deputy Chief of UNICEF'S Global HIV/AIDS Programs. He elaborates on the subject.
The report emphasizes the fact that we've had some successes since the beginning of the global fight against HIV. The other pandemic, we like to think of it as, we have, dramatically reduced the numbers of new infections being transmitted to children. And that's undoubtedly a result of the tremendous activism, enthusiasm and commitment of the global community to get women identified and treated with HIV drugs to prevent them from transmitting to their kids. What we have learned at UNICEF is that we have to be contextualized in our response. We have to look at the data and identify what is driving infections amongst young women, amongst children, where there are the gaps in terms of coverage of treatment services, and we have to target our responses. Just as an example, in many countries in sub-Saharan Africa, women are tested when they first show up in antenatal clinics, and if they're positive, they get started on antiretroviral treatment. That's great, and it's been incredibly successful as a strategy. But if you're in a country like Zimbabwe or Mozambique, the incidence of HIV is so high that during the time that a woman is pregnant and breastfeeding, which in many cases lasts 2 or 3 years or longer, there's a chance that as a young woman, she's likely to acquire HIV in that period. And the fact is, we're not doing enough to prevent those pregnant and breastfeeding women who are HIV negative from getting HIV infection. The other issue is that HIV is a lifelong illness. If you don't maintain treatment services, if you don't make sure that women are getting access to the treatment they need and taking the drugs effectively, then you won't see a continued and sustained response to the treatment. And you'll get these breakthrough transmission events where children continue to get infected despite our best efforts. I think COVID-19 has been a real wake-up call for us all. We've recognized really how fragile some of the gains that we've made are. And the fact is, during the worst months of lockdown, people were frightened to go to hospitals. Often when they went to hospitals, their clinics were shuttered because their staff were busy dealing with the implications of COVID. And even if they were in the clinic, drugs may not have been available because supply chains were so disrupted. But at the same time, it's been a learning experience. We've discovered that communities can actually treat people with HIV, that you don't need to give people a prescription every month. You can give them 6-month prescriptions or 3-month prescriptions and put them in charge of their own care. As with every World AIDS Day, we continue at UNICEF to call for the global community to recognize where we have failed children and mothers and to redouble our efforts to try to get us back on track.
That was Dr. Shaffiq Essajee, Deputy Chief of UNICEF's Global HIV/AIDS Programs, speaking to Africa 54 health correspondent Linord Moudou. The conflict in Ethiopia's Tigray region has pushed tens of thousands of people into refugee camps in Sudan, where aid groups are struggling to provide care. One Tigrayan doctor who fled the fighting has set up a clinic in Hashaba refugee camp in Al-Qadarif, Sudan. Naba Muhyiddin visited the camp and has this report.
Internal medicine specialist Daryl Logush was a well-known doctor in Hemura city in Ethiopia before he fled to Sudan this month. Daryl and other colleagues displaced from Ethiopia have now established a small clinic in Hashaba refugee camp, east of Sudan's Qadarif city, to help those in need of medication.
When we arrived here, we realized the need to make a clinic to help our people. Al-Qadarif State Bureau gave us some medicine to start working, but what we have got is essential medication for primary health care. People with acute diseases like TB, diabetes, heart failure and HIV have no medications. There is also no laboratory for diagnosis.
Hashaba camp has nearly 16,000 refugees. Women and children represent 70% of the arrivals, according to the camp administration. This clinic member notes that many fled Ethiopia without the medicines they require.
A lot of people fled from Homera, Mekdra, and Barakat and Western Tigray, there are a lot of people with HIV, TB, diabetes, and high blood pressure. They left their drugs because of the war. They displaced to Sudan without any of their medications.
Many international and Sudanese organizations are working to help the refugees' fragile health situation and are calling for aid from abroad.
Due to our work in health with refugees, we noticed the variety of fatal and acute diseases. We are sending a message to the international civil society organizations to provide aid and tools so we can protect people and control the possible spread of the diseases.
Hashaba camp director Mustafa Anwar is also putting out a call for help.
The heavy influx into the Hashaba camp in Hashaba region has reached 15,557. Under Sudan's hard economic situation, we call on international health organizations to quickly intervene, as people are in a state of emergency.
Sudanese authorities have reported a decreased number of new arrivals in recent days due to the closure of some borders in the Ethiopian side and the escalating turmoil in the Tigray region. Naba Muhiddin for VOA News, Hashaba Refugees Camp, Al-Qadarif.
Botswana is preparing to repatriate thousands of elephants to neighboring Angola to reduce overpopulation and conflict with farmers. The Southern African nation is home to nearly half of Africa's wild elephants. Tens of thousands of elephants fled Angola's decades-long civil war to Botswana. Nkodisi Dube reports from Chobe, Botswana.
Botswana is home to more than 130,000 elephants, the world's largest wild population. But tens of thousands are actually refugees who fled Angola's decades-long civil war, which ended in 2002. Conservationists say Botswana's elephant population has grown too big, leading to conflicts with farmers and shortages of food and water.
So a way to release this bottleneck, this compression, is creating safe corridors for elephants to move through, to repopulate and recolonize southeast Angola, where there are not so many elephants.
To enable this, Angola has agreed to remove leftover landmines from the war, and along with Botswana, fences that are blocking elephant migration.
We still get reports of poaching incidents in Angola. We know the landmines are still an issue, although they are working to try and get them out. So I don't know. I mean, this is what I do know, that it is quite important that we open up these corridors.
Botswana is part of the Kavango-Zambezi Transfrontier Conservation Area, CASA, a 5-country partnership to conserve shared natural resources. The group's executive director, Nyambe, says the partnership's goal is the free movement of wildlife within the region.
The long-term survival of elephants hinges on ensuring that we secure and connect or reconnect wildlife movement corridors, and on a transboundary scale. So when it comes to what the partner states are doing in terms of supporting particularly Angola, the 6 wildlife dispersal areas are all contributing to that process.
Botswana's President Mokwetsi Masisi has said they are more than willing to assist their neighbors with opening the borders to elephant migration and better management of their numbers. Mkondisi Dube for VOA News, Chobe, Botswana.
We're excited to hear what you think about Africa 54 and the stories we cover. Join the discussion on Facebook. The address is Africa 54. We're also streaming our broadcast live on Facebook. Please watch and share our show with your friends. Also check out our headlines 24/7 on voaafrica.com. Coming up, how one man is broadening the experience of horse riding. We'll be right back.
is about more than just sitting here and talking about women's issues. It's about listening to them
and bringing their opinions to the table and making sure their voices are heard.
Because our lived experiences, our stories, and our voices will help shape the next generation.
Health, wellness, sport, beauty, medical breakthroughs. Healthy Living cares about your well-being. What are the main health concerns in Africa and around the world? Find out the latest on coronavirus. Connect with our experts and ask them questions.
How long does the virus stay?
Join me, Linord Moudou, in Washington, every week on Healthy Living, right here on VOA.
Welcome back to Africa 54. COVID-19 has hit the global airlines industry very hard. Despite the challenges, the Ethiopian Airlines is flying daily out of Washington, D.C. VOA's Orion Itangishaka spoke to Nigusu Worku, Ethiopian Airlines U.S. Director of Operations, and asked him how they have been able to stay up in the skies while their competitors are laying off thousands of employees.
One is a business model itself. We have diversified aviation business model, which is Ethiopian has now 7 strategic business units. Like one is international passenger business, domestic business, cargo, MRO, ground handling. These are, in their own merit, strategic business units. And of course, we have aviation academy also. So when the passenger business was affected due to COVID, we started focusing on cargo. So that's one of the reasons we survived the challenge. But the second reason is agile leadership. You know, our leadership so agile that they took right steps at the right time. The profit margin of airlines in good times is 4%. Yeah, to put it in context, IT industry, technology, gets a profit margin up to 40%. So the only way to survive in the industry is you have to manage cost. And you have to also, of course, enhance revenue streams. So, but we have a cost leadership strategy in which we manage our unit cost. And that's also one of the success factors of Ethiopian Airlines. Initially, when the situation happened in March, April, May, there was panic by many passengers. So our passenger operation came down to 10%. And then in those times, we had lots of cargo, PPE, so we helped the situation with lots of revenue from cargo. But of late, we are witnessing a recovery in our passenger business. Now people are taking cautions and learning. So we see people traveling. For example, today we have around 220 passengers going to Africa, so which is a very good load factor for such flights. The third reason, a strong, dedicated, and committed workforce. I would say these are the reasons for the success of Ethiopian Airlines in this challenging time.
And a few weeks ago, you completed your expansion at Addis Ababa Bose International Airport.
Exactly.
With all that expansion and still wanting to stay profitable and a prominent airline on the continent.
Yeah.
Have you been spending more resources perhaps to convince people that it is still safe to continue to travel?
We have a 15 years long plan. So that's one of the reasons we had expansion project at Addis Bole Airport. And in terms of safety, in this COVID time, air travel, I tell you, is still the safest means of travel. And in fact, according to a recent Harvard study, air travel is safer than having a meal at a restaurant or buying grocery items. So we require employees and passengers to wear masks always, at all times. You know, we deep clean our aircraft, we sanitize, we disinfect. So all these measures are really assuring safety of our flights, both during the flight and in our hub at this our Bole airport.
For those who are traveling from here, the U.S., what is the first thing they should know before even booking a flight to the continent? Or what is the first thing they should do before booking a flight during this pandemic?
I would say they should check their destination's country's policy. For example, Ethiopia requires any passenger to produce a COVID negative certificate. So, for example, it's not for transit passengers. For anybody traveling into, for example, Ethiopia, should have a PCR, a COVID negative certificate. Likewise, rest of African countries or other countries have their own policies. And of course, they should avail their PPEs, like masks, sanitizers, and things like that. But we also avail, during the flight, sanitizers to our passengers.
Mr. Worku, from what other cities are the diaspora able to travel from the U.S. straight to the continent at the moment in this pandemic with AT?
Now we are currently flying from Washington, Dallas, this airport, daily. And we also fly from New York. We also fly from Chicago. So we are transporting passengers without any disruption, connecting people to Africa and the rest of the world.
That was VOA's Orion Itangishaka speaking to Negusu Worku, Ethiopian Airlines U.S. Director of Operations. In Afghanistan's central Bamiyan province, women have enjoyed relatively more freedom than elsewhere in the country, but many of them are now facing an uncertain future. VOA's Aisha Tanzim reports.
Bamiyan has become known around the world for its 6th century Buddha statues that were destroyed by the Taliban in 2001. It is also one of the few places in Afghanistan where women have been cycling in public, wearing modern clothing, attending classes with young men. In the last elections, it was the only province in which women voters outnumbered men. 18-year-old Shakiba Aryan understands that the freedoms she enjoys in Bamiyan are not allowed in most of the country.
Bamiyan is so good, the situation, and I'm very happy about this. In the first also, the Bamiyan was not the situation very good. But by the time now it is better.
These freedoms are a far cry from life under Taliban rule in the 1990s, when women could not leave the house alone, could not go to school, and had to cover themselves head to toe. After nearly 2 decades of war, in September, the militant group started official negotiations with a government team for a political settlement. Simultaneously, the United States announced a troop drawdown as part of its own deal with the Taliban. Many in Afghanistan think the militants have the upper hand at the negotiating table and will walk away with the lion's share of power. And the women in Bamiyan have started wondering how that might change their lives.
I personally worry around 80%. Because since my childhood, I had a lot of freedom in terms of education and sports and my family. If the Taliban come back, they will stop women from cycling, as even right now, our society has a problem with women cycling. In terms of education, they have accepted to allow women to get education, but in segregated settings.
Many of these young women have grown up in a post-Taliban era. They have also lived in a province considered safer than the rest of the country. Tourists from other provinces come to Bamiyan for a respite from daily security threats. Born after the fall of the Taliban, these young women have grown accustomed to certain rights. And now the possibility of a Taliban return to power, even through a political deal, creates fear that they may lose all the freedoms. Aisha Tanzim, VOA News, Bamiyan.
The joy of riding a horse is often confined to those in the countryside or other wealthy enough to make the needed arrangements. VOA's Marsha James profiles one man's efforts to broaden the experience.
When I was early childhood, my mother would take me to my uncles who were sharecroppers,
they had mules, and we rode the mules, and that was it. And then when we moved to Baltimore, I got involved with Nixon's Farm, where we did a summer program, and I got involved with the horses, and that was in the early 60s, and so I've been just at it ever since. I had a favorite, it died, and it was the genesis of this whole program. The program is City Ranch, and our mission is to make horseback riding accessible and affordable to the inner city, the Baltimore community, that may not have the opportunity to do it.
I've been here since February, so not too long, but I couldn't imagine my life without horses, so I'm very thankful to find this place.
I love it. I wouldn't come here if I didn't.
One thing that I focus on is taking the horses to where the children are, because if they don't have financial resources, getting out here, whether it's on a bus or an Uber or whatever the current method of transportation is difficult. So we want to take the horses into their community.
I really like being here at the farm. This is one of the most accepted places that I feel. Oh, I'm sorry, Bear. Just because I've never really had a barn buddy until I came here, and I've been riding for 10 years. Everyone here is so nice and welcoming, and I feel like a part of the family, even though I've only been here for a few months.
So, just letting it all.
Yeah, I'm sweaty now.
So what got me involved since 2009 was I was fresh out of high school. I've always loved and worked with horses. And when I went to Artscape in the summer of 2009, I was totally encapsulated. And Mr. Don was able to give me that outlet, and I've been able to work with so many students, so many children, so many adults, and really just share my passion with other people.
Okay. Creating an institution that outlasts me is when I'm gone, there is still a city ranch. It doesn't necessarily have to be the same name, but there's still an equine program dedicated and focused toward the community of Baltimore City.
And that's our show for today. Be sure to watch Africa 54 on our website at voaafrica.com. From all of us here in Washington, we thank you for watching.